Gynecologist and the American College of Physicians, all raising grave concerns, Mr. Chairman, about the Secretary's actions to undermine vaccines.
Can you tell me the date of that letter, Congressman?
No, I'm not asking a question. I have some to ask.
Okay, because I think that letter was sent
I'm just asking
about a week after I got in
Mr.
here.
Chairman, I haven't gotten my questions. I'm just asking unanimous consent to enter these into the record.
Without objection.
Just yes, sir.
Yes.
Okay, thank you. Now, since you became secretary, I have sent you 10 letters on a variety of topics, including the devastating workforce and program cuts at HHS. You've answered none, and your staff have given no indication that you intend to answer. You say you want transparency, but there's been no public process for any of this.
We have a public process for regulating vaccines. It's called the AZIP committee, and it's a public meeting. There will be public comment at that meeting.
Representative Frank Pallone confronted Health and Human Services Secretary Robert Kennedy Jr., accusing him of promoting anti-science views and ignoring congressional oversight.
Recognizes the ranking member of the full committee, Representative Pallone, for 5 minutes of questioning.
Thank you, Mr. Chairman. Secretary Kennedy, quite frankly, I think you're trying to defend the indefensible. There's no way that this budget or the actions you have taken thus far as Secretary are going to make this country healthier. And you keep talking about waste at the agency, but I mentioned in my opening there are 340 top scientists who signed a letter to the NIH director detailing unprecedented waste, abuse, and illegality at NIH under the Trump administration. And, you know, the thing that really disturbs me the most is this anti-science agenda that I think it's clear to me that the vast majority of scientists and medical professionals, you know, think your views on vaccines are dangerous, are not supported by scientific evidence. I'd like to ask the chairman, I'd like to ask unanimous consent to enter into the record a letter from 63 medical and public health groups and a letter from the American Academy of Family Physicians, American Academy of Pediatrics, American College of Obstetricians and Gynecologists, and the American College of Physicians, all raising grave concerns, Mr. Chairman, about the Secretary's actions to undermine vaccines.
Can you tell me the date of that letter, Congressman?
No, I'm not asking a question. I have some to ask.
Okay, because I think that letter was sent
I'm just asking
about a week after I got in
Mr.
here.
Chairman, I haven't gotten my questions. I'm just asking unanimous consent to enter these into the record.
Without objection.
Thank you. Mr. Secretary, the science is not on your side. I just really think that people are going to die as a result of your actions and congressional Republicans' actions. But you keep mentioning transparency during your testimony. You said it over and over again. But you promote, I consider, unfounded and unscientific therapies and conspiracy theories without data or evidence. And all of this has been done behind closed doors without any public engagement, despite your pledge to lead with, I think you called it, radical transparency. So let me ask you about, yes or no, though, about this radical transparency that you say you espouse. Do you believe that keeping Congress informed of your decisions and promptly answering inquiries from members of Congress fits within your promise for radical transparency? Just yes, sir.
Yes.
Okay, thank you. Now, since you became secretary, I have sent you 10 letters on a variety of topics, including the devastating workforce and program cuts at HHS. You've answered none, and your staff have given no indication that you intend to answer, despite being asked repeatedly. And this, in my opinion, is the opposite of radical transparency. I call it radical obstruction of congressional oversight. So again, yes or no, do you commit to providing a written, substantive response to all questions posed in each of these letters no later than August 1st? And if not, give me a date.
We've gotten an unprecedented number of letters from Congress, literally thousands upon thousands.
Okay, but I'm only asking for a date. Can you answer by August 1st?
And we are answering them as fast as we can, and all those letters will be answered.
I haven't gotten a single answer to any of them, Mr. Secretary.
Well, like I said, we have gotten thousands
I'm just asking you,
letters from Congress.
You said that you want to be transparent. You've said that Congress in responding to us is important. So can you give me a date? If not, I'm going to assume I'm never going to hear back. I said August 1st. August 15th? Tell me.
I'm not going to tell you a date.
Well, then I don't think I'm ever going to get a response. And I think your suggestion that somehow you're being transparent is simply not true. Now, one last question.
The clash centered on Kennedy's controversial vaccine stance, which has drawn criticism from top scientists and major medical organizations. Despite Kennedy's repeated claims of radical transparency, Pallone argued that the secretary has failed to respond to key letters from Congress and made major public health decisions without public input. The heated exchange highlights growing concerns over politicized science, transparency, and accountability in federal health policy.
Made a number of major decisions about vaccines, and again, there's been no public comment process or public accountability on that either. What are you afraid of? I mean, with regard to vaccines, are you just afraid of receiving public comments on proposals, or you just think these are fringe views that are contrary to the views of most scientists, and that the public comments will reflect this? You say you want transparency, but there's been no public process for any of this.
We have a public process for regulating vaccines. It's called the AZIP committee, and it's a public meeting. There will be public comment at that meeting.
You fired the AZIP.
I fired people who had conflicts with the pharmaceutical industry.
Oh, I mean, that's...
That industry, that committee has been a template for medical malpractice for 30 years.
I can't... The bottom line is here, we have no transparency. We have you feel no responsibility to Congress whatsoever. And you just continue this ideology that's anti-science, anti-vaccine. That's all I see. I see nothing else. And I don't think I'm ever going to get a response. And so I'm going to have to ask...
Will the gentleman yield?
My time is
Well,
up.
this is, Mr. Chairman, this is the Committee of Jurisdiction.
Gentlemen, the gentleman has yielded. The chair now recognizes the vice chair of the Committee of